Did you know that there are approximately 10 million people in the U.S. who suffer from chronic fibromyalgia? Did you also know that fibromyalgia is one of the most common pain conditions with a higher percentage of females being affected? What's the connection? Increased estrogen and decreased levels of progesterone affect pain perception and sensitivity. Another common denominator is an underactive thyroid. The thyroid gland controls the metabolism of every cell of your body. When the metabolism slows down, the amount of waste products within all the cells build up. This is why the fibromyalgia patient experiences generalized areas of pain. I had a patient referred to me with severe fibromyalgia symptoms. The patient's pain was so severe that she could not travel or be outside of her house for any extended periods of time. Just about every pain medication was prescribed for this patient with no results. Once I made a diagnosis of hypothyroidism and nutritionally approached the issue, the patient's pain dramatically reduced and she was able to assume a more normal lifestyle. Conventional blood tests are not as accurate as you would believe. This is one of the reasons why a diagnosis of hypothyroidism is often missed. From a layman's perspective, one just has to review their symptoms, take an armpit temperature reading for 30 days, and check their pulse regularly. There are 26 major symptoms associated with hypothyroidism: migraines, insomnia, weight gain, hair falling out, constipation, dizziness, hoarseness, brittle nails, increased tooth decay, dry skin, muscle spasms, weak ligaments, chronic fatigue, ringing in the ears, enlarged heart, frequent colds and flu, always feeling cold, non-pitting edema, and are some of the primary symptoms commonly associated with underactive thyroids. Broda Barnes, MD, PhD, conducted 20 years of research on hypothyroid patients. He found that over a 30-day period, their average armpit temperature was consistently below 97.8 Fahrenheit. Another researcher, Ray Peat, discovered that hypothyroid patients had a pulse in the 72 beats per minute range. This research also showed a normal reading should be around 85 beats per minute. If a person experiences many of the common symptoms of hypothyroidism, as a low temperature and low pulse, the probability of having an underactive thyroid is very great. With a preliminary diagnosis, one must find a naturopathic practitioner who can then define the underlying root cause. Eliminating the causative factors invariably will reduce or totally eliminate the chronic fibromyalgia pain. Check out icnr.com case studies.